Hey, hi, my name's Crystal. I am a 45-year-old female, obviously, and I wanted to upload a video to tell everybody about my PVC journey and issues with beta blockers and pre-ablation. I started with PVCs back in 1992 after I had my son. Went to see some doctors about it, and they told me I was just a nervous mother. So I just kind of lived with it and went on with it and didn't pay it any mind. I just thought maybe I had anxiety disorder, which I had, for quite a few years. But in around 2009, 2010, I started to have the PVCs a lot more often. And they became really bothersome. My blood pressure was also kind of borderline. So I went to the doctor and I seen a cardiologist and did some testing, had a stress test and EKG and those things, which did show that I was having some PVC. So the doctor just said, well, since your blood pressure's borderline and you're having these PVCs, we'll put you on 50 milligrams of Atenolol once a day. And foolishly, even though I'm a registered nurse, I really didn't research it too much, and I went ahead and took the medication. Started taking it when I got up in the morning, because I didn't really know any better. And I was just so tired, lethargic, wanting to sleep all the time, and I talked to my doctor about it, and they said, well, this will happen until you get used to it. So just take it at nighttime. So I did, and I did that for 3 years. Didn't have many problems. I guess maybe the end of 2012, beginning of 2013, I started having some more PVCs. Kind of really surprised me, because one day I was driving to work and my heart fluttered so bad I thought I was going to have to pull my vehicle in the middle of traffic to get somebody to stop to call an ambulance, but it stopped. So I just didn't think a whole lot more about it and went on to work, and thought, well, maybe I better go back and see what's up with this happening. So I really kind of didn't think about it too much, and more I guess lighter PVCs were happening more often, so I decided to go ahead at the beginning of this year and schedule an appointment with my primary doctor. Well, she sent me for an EKG and a Holter monitor. Well, as luck would have it for me, while I was having the Holter monitor done, it was 24 hours, I put it on and got the stomach flu. So I was vomiting all night long, and my lead came off, and I was very sick. So I know I had one PVC, but it really didn't capture the whole kind of picture of what was going on. So in the meantime, I was having a lot more PVCs, to the point where they were coming maybe every couple beats, and it scared me. It was very scary. Very terrifying. So I went to the hospital just to make sure and get checked out. So while I was at the hospital, they did notice that I was having PVCs, and they put me on oxygen, nasal cannula at 3 liters, because they said increasing your oxygen helps, and it did. I calmed down a little bit. I was still having them. Well, the wonderful doctor decided to come in, and she was like, well, I was a smoker. I've quit since then, but I was a smoker, and the doctor came in and she's like, well, obviously, this must have to be due to your breathing and brought on by your smoking, so we're going to give you a breathing treatment. So I took the breathing treatment, and lo and behold, my PVC started back up again, even though they had calmed down, and I brought that to their attention because they were preparing the discharge papers. So they came in and gave me some Ativan, I guess, just to kind of calm down the adrenaline, which helped, and I drove home. A couple days later, I ended up getting the flu, as luck would have it. So while I had the flu, I noticed that the PVCs got even worse. My coughing, of course, got worse. I was put on antibiotics. I also had around the steroids. They also gave me an inhaler. I was having PVCs a lot. Well, I took the inhaler one night and had an episode where I actually thought I was going to pass out, and I stood up to get someone to help me, and by the time I stood up, it stopped. I actually found out that I was having a PSVT and not a PVC, so I guess I can't really do inhalers anymore. But what was strange was that I noticed that everyone thought I was crazy, but while I was sleeping, I didn't feel like I was falling asleep. I actually felt like I was passing out when I laid down. I knew it was different because my mind kind of thinks of things and I kind of trail off into sleep, but what would happen was I would lay down to go to sleep and I would be laying there thinking about, you know, things that happened during the day, and all of a sudden I would just be in total blackness. And this happened to me, I guess, maybe 3 times before I decided to check my vital signs. I'm a nurse, like I said, and I have equipment. I don't know why it didn't dawn on me before. And I found out my heart rate was 43. My blood pressure was 86/63. So I was pretty significant, and it bothered me some. So I said, well, you know, I'm going to keep this in mind and keep just watching it myself. I'm not going to, you know, maybe it was just a one-time thing. But I tended to get like what I call an aura beforehand, I noticed. I would get ringing in my ears. My chest felt really heavy. I was having difficulty breathing, even though I checked my pulse ox and my oxygen level was 96 or above, which is kind of normal for me when I was smoking. But I noticed that when I had these feelings, this is when my blood pressure and heart rate would kind of bottom out. So what really scared me is one night I was driving and I got the aura again, but I didn't have any equipment to check myself. So I went to the emergency room, and that doctor there just kind of, to me, thought he thought he knew everything, and I told him what was happening, and I tried to give him my history, and he didn't really want to hear it. He just wanted to know why was I there right now. And I said I was there because I had gotten dizzy. And he told me I was having a panic attack. And I said, I'm really angry with you right now. And I said, my heart rate is 70. I said, so imagine what's going to happen when I calm down. I said, because I'm really angry and my heart rate's only 70. So I knew at that point that I just had to, like, kind of eat it, and calm down, and let them see, you know, while I was calm, what was happening. So about an hour later, he came in and he's like, you know, your heart rate is like 53. And I said, yeah, and I'm wide awake. This is what I was telling you. So I had been taking the 50 milligram of Atenolol. The ER doctor called my cardiologist and told them what was going on. And he told me to go ahead and stop the Atenolol right then and there. So this was a Friday evening. So I did. Sunday, I gardened, so I decided to go out to weed my garden, and I was outside like 5 minutes weeding, and I was so tachycardic I could hardly even breathe. I felt like I was going to pass out, and I came in and I checked my pulse. It was like 122. I was unaware that stopping Atenolol would have a rebound effect till I started to research it. So Monday morning, I was in my cardiologist's office. I walked back the hallway just from the waiting room to get my vital signs taken, and my heart rate was 122. So they put me on a treadmill. The doctor was there with me, and within 1 minute my heart rate was 163 and my blood pressure was 141/110. So the doctor was like, well, that's very interesting, and he's like, you know, you need to go back on the Atenolol, but we're only going to do 25 milligrams and you need to take it in the morning instead of night. So this is what I did.